Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, hospitals see a rising trend of COVID-19 cases in the last few weeks, with the country surpassing 600,000 COVID-19 cases. Local government units are now intensifying measures to stop the spread of COVID-19, but will these be enough? Health Undersecretary and Treatment Czar Leopoldo Vega joins us live. And lawyers are asking the Supreme Court to stop the implementation of the anti-terrorism law following the killing of 9 activists last Sunday. Former Bayan Muna Representative Nery Colmenares joins us later in the program. From curfews to stricter implementation of minimum health standards, local government units are now doubling efforts to curb the spread of COVID-19. And with the increasing number of COVID-19 patients, some hospitals in Metro Manila say they are now at full capacity. So what's the government's plan to make sure the healthcare system will not be overwhelmed? Let's go straight to the source of the story. We have Health Undersecretary and Treatment Czar Leopoldo Vega. Yusek Vega, welcome to The Source, and thank you so much for your time.
Thank you, Pinky, and also good morning to all the listeners today. Yeah.
Yusek, let's look at the numbers. Tuesday, we had about 2,700 cases. The past 4 days, though prior to that, we had over 3,000 cases a day. Is this worrying you?
Yes, it's kind of alarming because this is almost a repeat of what's happened in August of 2020. And it seems like the data that we're looking at, it's almost half of the peak times of July and August of 2020. And I'm say alarming because we are not able to control this in terms of containment of the virus. Then definitely there might be a possibility of the surge in the hospitals right now.
Right.
And bearing on this, I would like to point out that there are regions, really, Region 2 and CAR and NCR and Region 7 having increased in their healthcare utilization rate.
Yeah.
And that's why we're actually preparing in terms of the necessary arrangement for this.
Yeah, you know, if we have to even look at the hospitals, all the hospitals, well, most, that has come out in the news is already saying that there's been an increase. They saw an increase already. I want to talk about USEC St. Luke's, Quezon City, because I was able to speak to Dr. Campomanes yesterday, and he said that the ICU in St. Luke's, Quezon City is actually full. They can't take in any more patients in their ICU. In the event that somebody needs to go through ICU, kailangan po dalhin sa BGC or any other hospital. And then here's another thing that I wanted to discuss with you. If we look at beds, I understand government said to the hospitals, allot 20% of the beds. St. Luke's BGC, their COVID beds is 90% full. And we're talking about 110 beds there. So sabihin na po natin 90 beds are full. PGH, Dr. Gap Legaspi was saying they have about 140 beds, 98 are occupied. So parang, sir, ang konti ho eh. Kasi even if we say 80% occupied or 90% occupied, we're really just looking at about 100 beds for those hospitals. Maliit po yung number ng beds.
Yeah, but since Pinky, you should understand, but since last year we have tried to upgrade and expand the different government-retained hospitals. In fact, we inaugurated the late part of August, the East Avenue Medical Center, which is really
Okay. We're having problems with our signal with Yusek Vega.
Yes, can
Yusek,
you hear me?
I lost you, yes. I lost you at East Avenue, sabi niyo po.
Yeah, we inaugurated last year, the August, by I think the last week of August, the East Avenue IRID Center, which actually caters to pure COVID patients. And we also expanded the capacity of Jose Rodriguez to more than 40 beds. And in fact, we came up with a modular hospital there. So in other words, we have been trying to ramp up and scale up the intensive care units, even in Lung Center. But apparently right now, what we see is the number of cases are up primarily because the non-COVID cases are also going up. In other words, the hospitals have tried to also open up and allocate non-COVID patients. And this is at the time when we have a rise in the COVID. So definitely what we intend to do and ask the different hospitals is that they must go back to the 20% allocation of their beds and even more
Right.
if there are if there is surge in these cases.
Well, that's where I wanted to go next. I was going to ask you if you are going to tell the hospitals now to increase that 20% bed capacity mandated by government. Kailangan na ho ba itong itaas to possibly even 30%?
Yeah, right. Right now, the government-retained hospitals are between 35 to 37%, while the private institutions are now in the 20% category. But remember, last year, the private hospitals were just allocating 11% of their beds, and the government was already ramping up towards 28 to 30%, but at that time. So definitely, we have increased the number of beds. It's just that we need to allocate more since there are non-COVID patients actually being managed in the different.
Yeah, we're talking about non-COVID patients. Yusek Vega, I'm losing you again. Okay, you were saying, we're also talking about non-COVID patients. Hindi lang talaga COVID patients ang inaasikaso ng mga ospital.
That's true. That's true, Pinky. In fact, when the COVID cases went down after in September, October, November, most of the hospitals decided that they must also treat and manage the non-COVID patients, especially the elective ones, no, that would need clinical care. And that's the reason why there's now a big percentage of these non-COVID patients in the several institutions. Also have a surge in COVID, and this is the reason why we are meeting up again with the One Hospital Command Center together with the medical chiefs to make sure that the COVID clients are given the necessary access to most of these hospitals.
Yusek, first, when we started the interview, you said the numbers are quite worrying. What happens if matuloy po yung sinasabi ng Okta that we can reach 4,000 by next week or even 5,000 to 6,000 by the end of March? What number would you say na aabutin natin that sasabihin yung critical na po tayo?
Alam mo, Pinky, if you look at the projections made by Okta, these are actually assumptions if nothing is to be done. In other words, if we don't do anything, if it's still business as usual and we don't do the minimum health standards, then definitely the rise will come. But if we are to do something and make sure that the projection doesn't work, and the 20, we have to make sure that the local government units, and I'm a witness to the different local government units in terms of their capacity to make sure that they implement the containment of the virus by the localized lockdown and improving their isolation.
Yeah.
So in other words, what I'm saying is we don't want a repeat of that.
We don't.
We have to make sure that the projection doesn't move towards 20 to 30%. We have to do something about it. And if we do something about it, I think the assumptions will not be that way.
But Yusek Vega, tell us, as because you are the head of the One Hospital Command, ano po yung numero that masasabi ninyo na nakakatakot na ho talaga ito?
When we have the number of percentages, especially with the One Hospital Command, wherein we would have the high-risk category of all COVID beds, whether it's going to be the ICU, the ventilators, or the COVID, or the COVID areas for the moderate cases, then that would be quite overwhelming. And the only way to do that, to decongest that through the One Hospital Command, is to make sure that the other regions, because we have established regional health commands outside of Metro Manila, and we will soon transport these patients and allocate these patients that would need clinical care or critical care in some other areas outside of the metropolis. So in other words, One Hospital Command really is there for a coordinated care, especially with the different hospitals and the referral system.
I do remember Dr. Gap Legaspi telling me yesterday that he's thankful because of this One Hospital Command dahil nga nalilipat yung mga pasyente. So you're not, what I'm getting from you is you're not looking at numbers, you're looking at the capacity. Opo, the
capacity,
ICU.
the percentage. Yes. We're looking here at the percentages, especially now that the in the metropolis or in NCR, we have an increase in about 20% in the intensive care units. So that's mostly siguro in our one hospital commands that for this week we had 60 patients more. And for the COVID beds, we had almost 400 patients more. So in other words, there really is an increase of about 24% in terms of the COVID
Severe.
patients.
Opo.
Yeah.
So you're saying sa intensive care, Yusek, tumaas na po ng 24%?
Yes, tumaas, Pinky, and that's the reason why since last year we set up the modular hospital through the DPWH, wherein they can actually cater to severe and critical cases. So we have this in the QI right now. We inaugurated it about 2 months ago. We will soon operationalize this and ipa-function namin because this will cater to moderate and severe and address the problems really of these patients needing this kind of treatment. So this would be under the Jose Reyes Memorial Medical Center.
Pero sorry sir, didn't quite catch a part of what you said. Bubuksan pa lang ito. Tama po?
Yeah, because it was built last November. I think 3 modules have already been done. And we are going to make sure that equipment is there, and this can serve as the moderate and severe. So in other words, all referrals coming from the one hospital command will definitely be coordinated and referred to that areas wherein there is an allocated bed for an intensive care patient.
And how many beds are you looking at for this particular modular hospital?
We have right now 110 beds for this modular hospital in QI. And there's another one in Tala or Jose Rodriguez that we have also made this modular hospital for 40 beds. But aside, of course, we have also expanded the capacity of lung center. We have actually transformed part of the wards to become intensive care units to make sure that they are able to respond appropriately to severe and critical patients.
What about the frontliners, Yusek? What's the update there? Our
For the frontliners, yes, for our frontliners, we've made sure since last year that we augmented the different human resource of the different institutions. No? So nagkaroon kami ng mga emergency hiring, and up to now, we're still maintaining about 15,000, close to 15,000 of healthcare workers in different public and private institutions across the country that would need them. So in other words, we have maintained that. We have to make sure that the adequate and competent health force are there for the different institutions. So, and we are also starting off with the vaccination of the healthcare workers right now. In fact, we're already ramping this up into the different provinces and hospitals, both public and private, here in the NCR and even the different provinces in the Philippines.
Right, Luzon, Visayas, and Mindanao. Yusek, we were talking about this projection of OCTA. So government is already saying we need to strictly implement minimum health standards. There's already an order also from the DOTR to strictly implement social distancing and what is necessary during for those commuting. But as head of the One Hospital Command, what do you think what else needs to be done? Maliban na po dun sa strictly following health standards, nakikita niyo ho ba na maybe we should start imposing curfews because right now only Caloocan and San Juan are imposing curfews. What else needs to be done, sir?
Pinky, there are lessons learned from last year and in August of 2020. Have you noticed that last year we were able to contain the virus and make sure that it went down into the several months that went ahead? So we are now moving again the same kind of strategy. We have to contain this virus by doing localized lockdowns. And I think the Metro Manila mayors, and I've seen this and I've witnessed this, how their assertiveness, their dynamism in terms of making sure that their localities will be at least free from the virus transmission by doing localized lockdown. So it's not just the minimum health standards that we're talking here, but minimum health standards with of course, with public or police visibility, that means enforcement. So it needs to be enforced. These localized lockdowns have to be enforced once again because, the transmission of this virus occurs in clusters and in barangays and in families. So the only way that we can contain this is if we can actually make sure that they are isolated and contact trace in terms of the different people that they were with. If you are able to isolate, if you are able to detect them and do the localized lockdown, I think we will go back again and we can make sure that the virus can be tamed or the transmission can be lowered down.
Yusek, is this the second wave, or is this just a surge?
It's hard to say if it's a second wave, but apparently there's now several peaks that are moving or increasing trends. No, it's almost a half of what we had almost of last year. If this continues and then if actually rises up to another same peak as we had in August and July of last year, then definitely this might be. But looking at it from the data, it peaked and then it went down again yesterday to about 2,600 new cases. In other words, there are peaks and then there's a decreasing trend. So it's just really an uptrend of the transmission of the virus, and not really to say that this is going to be a second wave.
1 year into the lockdown, Yusek, government describes as excellent government's response to the COVID pandemic. Do you agree?
Yes, totally. If we are not able to do this, then I think there will be more transmission. Because if you take it to Metro Manila, this is the highly dense, populous area. And, the virus actually thrives in high-density populated areas. And we were not able to put down the necessary response, necessary containment, and even testing. Then we would have a problem in terms of the positive cases and, of course, the surge in hospitals.
Health Undersecretary and Treatment Czar, Leopoldo Vega. Yusek, thank you so much for your time. I know that you have somewhere else to go, but we thank you for giving us 15 minutes of your time.
Salamat, Pinky, and to all the listeners. Thank you for hearing me.
Thank you, sir. We'll be taking a short break. This is The Source on CNN Philippines. Please stay tuned.